Hello and welcome to 72 Dragons Health. Today we had the pleasure of speaking with Karmen Reynolds. Karmen Reynolds is an accomplished early childhood health systems coordinator at Grand Beginnings, Granby, Colorado, United States, where she manages the Meeting Milestones Initiative. This program focuses on providing critical health screenings for young children in Grand and Jackson counties, Granby, Colorado. Her expertise spans from program management, health advocacy, and early childhood development, and she is passionate about child and maternal health education. Karmen also serves as a program co-chair for the Genomics Forum at the American Public Health Association, APHA. Her previous experience includes a visiting scholar position at the Michigan Public Health Institute, where she evaluated a virtual learning project for familial hypercholesterolemia, contributing to her master's thesis. She has also worked as a clinical research assistant at the University of Pittsburgh Medical Center, UPMC, Children's Hospital of Pittsburgh, where she played a key role in national epidemiological studies. With a strong foundation in health systems and advocacy, Karmen is dedicated to improving the health and well-being of children and their families through her various roles. Welcome to this interview, Karmen Reynolds. We are indeed honored to have you with us today.
Thank you so much.
Karmen, in your role as program co-chair for the Genomics Forum at APHA, what initiatives are you currently focusing on?
So right now, we're really excited at the Genomics Forum. We have just had a donation page go live, so we are actually able to start funding some of our initiatives, which is a big success for us because everything has been completely volunteer-based, which it will remain, but now we are really hoping that we can start to provide some scholarships to genomics scholars who are enrolled in current genomics programs throughout the country and who are also members of American Public Health Association. So that's something that we're really excited about. The other project that we have on the horizon is we're working on getting a series of webinars started about topics in public health genetics and genomics. And so we're super excited to hopefully have these quarterly discussions. We're getting information from our membership to engage them in topics that they want to learn more about in genetics and genomics. And hopefully we can really just spread more awareness of what's going on currently in the world of public health genomics.
Congratulations on those achievements. Now, going to your master thesis, what findings from your master thesis on familial hypercholesterolemia are most significant for pediatric care?
The most significant finding is something that we already knew a little bit going into it, which is that there's not a lot of awareness of what genetic conditions certain screening recommendations are actually there for. So in the case of familial hypercholesterolemia, pediatric lipid screening is used, and there's just not a lot of awareness even among certified family practice physicians, pediatricians, physician assistants, what those recommendations are there for. And high cholesterol is seen as something that is an adult disease and something that affects adults. And in the case of familial hypercholesterolemia, this is something that is an inherited condition that affects children as soon as they're born. They start having the effects of the condition. And so it's really important that screenings are done universally. And currently, the data shows that only about 20% of kids actually receive pediatric lipid screening in the recommended time period. But we found in this virtual learning series that after learning what familial hypercholesterolemia is and understanding why the recommendation exists and not just as a way to find kids with high cholesterol, but kids with an inherited disease that causes high cholesterol that might not be visible, we saw an increase to a 73% screening rate as opposed to the 20% that was before. And this was a very small study done in the context of a continuing education and quality improvement training. But it's still very exciting to see that education works and awareness about what screening recommendations are for is a really good motivator for family physicians, pediatricians, and other pediatric care providers to follow through and make sure that we're catching these kids with the inherited disorders.
The important screening and it significantly increased after the study was implemented. Can you describe the Meeting Milestones Initiative and its impact on the community?
Yes, so the Meeting Milestones Initiative is a really unique program that it was founded by a coalition of stakeholders in Granby and Jackson counties. So it is really a collaboration between a lot of different groups in the community, between physicians in the area, nonprofits, us at Grand Beginnings, who are the Early Childhood Council for Grand and Jackson County, as well as the school districts and early childhood education centers. It's really unique in that all of these organizations came together as a community to uplift the health and wellness of our children. Location of our community is extremely rural, and we're also located in the middle of a bunch of different mountains. So there's a lot of physical barriers that prevent people who live up here from accessing regular healthcare. And so one of the ways that the Meeting Milestones Initiative addresses that is through universal vision, hearing, dental, and developmental screenings. And so between the different partners in the county public health department, as well as the different family physicians in the area, and us at Grand Beginnings, we're able to screen almost all of the children in our community. Prior to the pandemic, we had about a 98% screening rate for all the children in our community. Post-pandemic, we're sitting at about 76% screening rate, which is less, but it's still really awesome. And so this is a really great program that helps us identify kids who are in need of early intervention or certain health, who need a little bit of extra help with their development or any other health conditions.
Very impressive work. Thank you for sharing. Now, how do you keep up with the latest trends and research in public health and early childhood development? Can you tell us about any recent trends or research that excites you most?
The main way that I actually keep up with what's going on in the fields of early childhood health and in genomics is actually through newsletters. I sign up for so many newsletters from as many organizations as I can that are relevant to the work that I do and the research that I'm interested in. And They actually are such a wonderful resource of just information about what research is up and coming, and also often they'll be advertising webinars that are being done. And those are really wonderful learning opportunities to get to learn in a little bit more depth what topics are relevant and up and coming in public health genetics and also early childhood health. Some exciting research that I am really looking forward to learning more about is the vaccine effectiveness of nirsevimab, or Beyfortus, which is the RSV vaccine that was approved last fall. In my role as a clinical research assistant at the Children's Hospital of Pittsburgh, this is one of the studies that I worked on and collected data for. And what we found in the first season was that it was highly effective at preventing hospitalization and reducing the severity of RSV illness in children, specifically infants. I'm really excited to see what happens this respiratory season. And I'm very much looking forward to learning a little bit more about how immunity is passed from mom to baby during gestation or through breast milk. And that's another study that I was involved in at Pitt, and I'm really looking forward to reading the results of those papers.
Now, how do you see the role of genomics evolving in public health, particularly concerning early childhood health?
Public health genomics is really growing, and I just see a really big trend towards personalized medicine involving genomic data. It's a little bit difficult to say right now, and my answer now is a little bit different than it would have been a year and a half ago, because the National Coordinating Centers for the Regional Genetics Networks have actually been sunsetted. They did not have renewed funding after last year. So that was a huge infrastructure building for public health genomics. And so it might look a little bit different, and it might be a little bit more of a winding path, but I do see in the future that we will have greatly expanded newborn screening programs. I wouldn't be surprised if eventually we see whole exome sequencing or whole genome sequencing, as opposed to the blood spot panels that we currently do for newborn screening. It's getting a lot more efficient and a lot cheaper to do these whole exome and whole genome sequencing operations. So I think once we reach a certain point of efficiency with that, we will see way more widespread use of that in newborn screening. I think it'll also have some really strong implications for early childhood development as well, and our understanding of how children's brains develop and different developmental delays, and especially autism spectrum disorder. We're already learning so much from the few studies that we have doing analysis of what genes are associated with that, and using whole exomes especially to learn more about that. And so I really see that information growing in the future.
Thank you. Yeah, genomics really have a lot of new opportunities as well as some challenges, but really looking forward for those new opportunities it brings into health. Karmen Reynolds, thank you for your exceptional work as an early childhood health systems coordinator and important contributions to the American Public Health Association Genomics Forum. Your dedication to advancing child and maternal health through initiatives like Meeting Milestones is commendable. We wish you much success in your upcoming projects. Thank you.
Thank you so much.